So the question, one of the ultimate questions for clients, when to keep teeth, when to let them go, do we keep our teeth? Another question I sometimes get from clients is, are we supposed to keep our teeth? I've had every question under the sun in the last 2 decades from clients regarding, is it worth it, right? Is it worth keeping my teeth? And my answer in the short is yes. The long view is it depends on the situation or the damage on the teeth themselves. But as far as the big picture is keeping natural teeth is always the best scenario if possible. And the reason is a technical reason, and that is, while I love implants and their application for missing teeth or for teeth that are so badly damaged we just can't restore them, and that happens, clients have all kinds of interesting stories, and some of them are they've had dentistry over and over again on a tooth, and no matter what happens, there's just reinfection and problems and pain. Another one might be they've had a lot of treatment on the tooth and the tooth is fractured. So there are instances, or trauma. There's another one, sports injuries. I have clients that come in where they have been hit in the mouth, with a ball. And so there are some instances where teeth come out. And those stories, first of all, are deeply personal. So the first thing is, I don't start talking right away about replacing the tooth or taking the tooth out. The first thing is I want to know how they feel about taking a tooth or losing a tooth. Some clients, it's not a big deal. They're ready to go. They've knocked a tooth out with a baseball and they understand it's not salvageable, and we go in the process of talking about removing that tooth. But for many clients, it's like losing a finger. It's a big deal, especially when we're talking about the smile zone, right? That area where every time we look at our kids, our family, our friends, our coworkers, we're conscious of the fact that that tooth isn't there or is not going to be there. For those clients, it is worth taking a moment, taking a pause, and just discussing with them first why we take the tooth out. Because I really want them to understand that if we're going to commit to that decision, let's make sure that it makes sense to them. The second thing is talking about the options. Not every solution is implant, but absolutely when we're losing a tooth, an implant is a great option if the jaw allows and conditions like medical histories and so forth allow. So as far as keeping teeth, here's the main reason. Our design, the creation of our teeth and our gum and our bone, it's designed to actually move. And so a lot of people don't realize our teeth actually move like little shock absorbers. And so when I'm chewing, eating, so forth, when the teeth come in contact, there's movement. It's dynamic. There's this whole cellular thing going on where bone is growing and bone is resorbing. And how do you think orthodontics happens? It's not something the average person thinks about, but just think about it for a moment. How can I move a tooth that's here to here? Well, the way that works is there's cells that eat bone and cells that build bone. And there's bone building behind the tooth as it's being moved. And there's bone cells that are eating, called osteoclasts, that are eating the bone in front, and it's related to pressure. And so when you keep teeth, you keep natural, right? You keep that movement and you keep bone. And what happens commonly with patients, as soon as we lose a tooth, one of the things that a lot of people don't realize is, as soon as we lose a tooth, we lose bone immediately. We start that process of bone loss. And so one of the things that I offer as an example on what makes us just next level, and I say that with confidence because I've seen other people do this, and I've seen why it works. And I knew I had to have it be part of my practice. But what's next level is not taking teeth out and then leaving a big hole to heal, which creates a defect in the jaw and the gum, but bone graft that site. A lot of clients don't realize that while there's some added cost there, the long-term benefit, we talk about long view. My gosh, the long view on grafting a missing tooth site when I have to lose a tooth is phenomenal. It builds foundation. And it allows the gum and the bone to stay healthy and full so that when we restore that area, whether it's with an implant or a bridge or whatever that issue, whatever we choose to do, the client and I kind of co-discovering the right way to do this, there's a good foundation to work with.